Good evening, everyone. I welcome you all to the session today. Today we are conducting session of Pragnavaridhi lecture series. We have Sreekanth sir. Sir will be teaching about anatomy of ear. Um, Before that, I'll give introduction about Panchajanya. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of following and imbibing the culture, accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, and its values to all strata of people in every corner of the world. Also, the founders being Ayurveda aspirants, we know the inside out of today's medical field, hence, they aim to make people aware of this and also try their best to solve this on the go. In order for all this to be achieved, we have set up various wings with working principles and objectives that help achieve the goals faster and easier in the coming years. They are Team Swami Vivekananda, Team Ashwin, Team Veda Vyasa, Team Sanjaya and Nalanda. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation available aiming at working together and bringing forward the true essence of Bharat and her traditions. So, all those who feel very glad to have you in this session today, sir.
Yeah, thank you.
Over to you, sir. You can start the session now.
Okay, thank you. First of all, I'd like to convey my thanks to the coordinators of the PRAGNAVARIDHI lecture series. And yeah, myself, Dr. Sreekanth, we'll be discussing regarding the anatomy of ear from the perspective of an examination view. Okay. Yeah, in the NCISM syllabus, we all know that the what you tell anatomy of ear can be asked for both all the three categories. That is SAQ, which consists of 5-mark questions, and LAQ, which consists of 10 marks, and the what you tell MCQs. So all the three you can expect the questions from all the three categories. Okay, and uh, starting with the discussion of anatomy of ear. To give a general introduction regarding the anatomy of ear, we all know that it is one among the sense organs, and this is it contains the organ of hearing, and also it helps in the kind of what you tell controlling the mechanism of equilibrium of our body. Okay, and the ear anatomy can be studied under main three headings. That is the parts external ear, middle ear, and internal ear. Okay, we'll start with the external part, that is external ear. Mainly, the external ear consists of two major parts. Okay, external ear major consists of two major parts. That is auricle or pinna. You can see here. This is the auricle or pinna and the external acoustic meatus. Okay, auricular pinna and external acoustic meatus are the two parts of external ear. Okay, and sorry. Yeah, and starting with the auricle, The oracle can be considered as, or for the layman's, they address this as ear, right? Because the it is a visible ear, and other parts of the ear are inside the cranium or inside the skull, right? So the oracle can be considered as the visible ear, and it is made up of elastic cartilage. It is made up of elastic cartilage, and then both the surfaces, that is anterior and posterior surfaces of the auricle or pinna, is covered by skin. Okay, and whenever it is this external ear is asked for 5 marks, when you write regarding the what you tell oracle, you can put these two small points in up front and then directly go for the parts. Okay, for parts you can draw a diagram and just label the parts. Mainly you have to label 7 parts. That is the helix. This is the helix, anti-helix, tragus, antitragus, concha. This whole part, this depressed part is called as concha, and the scaphoid fossa. And the last part or the seventh part is lobule. I'll repeat once more. The parts of auricle is helix, antihelix, tragus, antitragus, concha, scaphoid fossa, and lobule. Okay, you draw a diagram and then mark these all parts, label them properly, and then we'll move on to the next part. You can see the another model picture of the oracle. Right. So after giving the introduction of what is auricle, that is, it is the outermost part of the external ear, and it is covered by skin. It is made up of elastic cartilage, and drawing a diagram and labeling the parts of it, the 7 parts, that is helix, antihelix, tragus, antitragus, scaphoid fossa, and the lobule. Then we'll move on to the next heading, that is the blood supply. Under the blood supply, the arterial supply is done by majorly two arteries, that is the posterior auricular artery, and the superficial temporal artery. Blood supply is done by posterior auricular artery and superficial temporal artery, and the venous drainage is mainly done by two major veins. You can quote the posterior auricular vein, posterior auricular vein, and the posterior external jugular vein is not needed. Quoting the what do you tell, the name of the posterior auricular vein under the venous drainage is enough. And then the lymphatic drainage, it is done by the pre-auricular and the post-auricular lymph nodes. Pre-auricular and the post-auricular lymph nodes. Then coming to the nerve supply of auricle or pinna. Nerve supply is done by, it can be kind of explained under two main headings. The lateral surface of the your auricle and the medial surface of the auricle. The lateral surface, the major three nerves that supply the nerve supply to the auricle is by auriculotemporal nerve, the greater articular nerve, and the those two major nerve supplies the auricle of the nerve supply to the auricle. And then the medial surface, the nerve supply is done by the lesser occipital nerve, the auricular branch of vagus nerve, and the greater auricular nerve. Okay, I'll repeat once more. The external ear, it is classified into two parts, that is auricle or pinna and the external acoustic meatus. The auricular pinna, it is nothing but the externalmost part of the ear, and it is made up of elastic cartilage, and then both the surfaces is covered by skin, and the kind of parts, there are majorly 7 parts: helix, antihelix, tragus, antitragus, concha, scaphoid fossa, and lobule. This all the parts has been shown to you. And then coming to the blood supply, the major blood supply is from posterior auricular artery and superficial temporal artery. The venous drainage is done by the posterior auricular vein. Lymphatic drainage is done by the nodes of lymph nodes of pre-auricular and post-auricular nodes, and the nerve supply, lateral surface, is done by auriculotemporal nerve and greater auricular nerve, while the medial surface, the nerve supply is done by lesser occipital, auricular branch of vagus, and the greater auricular nerve. Okay, so that is regarding the auricle or pinna. Now moving on to the next part of your external ear, that is external auditory meatus. Okay, external auditory meatus is also called as the external auditory canal or external acoustic meatus. Acoustic means related to the sound. Okay, so external auditory meatus or external acoustic meatus or external auditory canal can be named for this part. Okay, so the external auditory meatus, it extends from the concha. It extends from the concha until the internal boundary is the tympanic membrane. So the external acoustic meatus is a canal that extends from the concha uh, to the tympanic membrane. Okay, and the external auditory meatus or acoustic meatus is sinusly curved or it is S-shaped. Okay, it is S-shaped, it is sinusly curved, and upon coronal section of the external auditory meatus, it is oval in shape. Upon coronal section, it is oval in shape, but it is sinusly curved, S-shaped curve. We can see a bit of S-shaped curve here. See, S-shaped curve, and upon coronal section, it is oval in shape, and then the total length of external auditory meatus is 20 millimeter. The total length of external auditory meatus is 20 millimeter. And then this whole external acoustic meatus is divided into two parts. This whole external acoustic meatus is divided into two parts. The outer part, you can see here, the outer part is called as cartilaginous part. The inner part is called as bony part. So why it is named as cartilaginous and bony? We know that the what is the outer part is made up of cartilage. That is why it is called as cartilaginous part. Inner part is made up of bony or bone. That is why it is called as bony part. Okay. So I have told the whole length is 20 millimeter, right? So the what is the outer cartilaginous part is or lateral cartilaginous part consists of 20 out of the 24 mm, it consists of 8 mm. Okay, outer or the kind of lateral part of the external acoustic meatus consists of 8 mm is cartilaginous, and the inner bony part consists of 18 mm. So 18 plus 6, total of 24 mm in length. 8 mm of the cartilaginous part and 16 mm of the bony part. Okay, now we will see regarding the bony part. Okay, the bony part, it is made up of C-shaped tympanic plate. Okay, C-shaped tympanic plate of the tympanic plate is of temporal bone. Okay, this is C-shaped. It consists of C-shaped your tympanic plate. So we know that C doesn't kind of complete the circle, right? So the gap of the C, or where there is absence of tympanic plate of temporal bone. I'll repeat once more. There is a bony part and an cartilaginous part. The bony part is formed by the C-shaped tympanic plate of temporal bone. The C-shaped, as it is C-shaped, there is a gap. That gap, which is formed due to the absence of the tympanic plate, is covered by the squamous part of temporal bone. Okay, I'll repeat. Uh, the C-shaped tympanic plate forms the bony part, and where there is an absence of the tympanic plate, that part is covered by the squamous part of the your temporal. Okay, and the canal that is present within the bony part is covered by thin skin, and not a lot of what do you tell sebaceous glands are present in the bony part. But when coming to the cartilaginous part, as we have told, it is 8 mm, and this is formed by C-shaped cartilage, and the gap is filled by fibrous tissue. The gap of the C is filled by fibrous tissue. Here it was filled by, in the bony part, it was filled by squamous part of temporal bone. Here it is filled by the fibrous tissue. And within the canal that is present in the cartilaginous part, a lot of sebaceous glands and ceruminous glands are present. These ceruminous glands are nothing but modified sebaceous glands which produces cerumen. Cerumen is the earwax. Okay, they are specialized to produce the cerumen. Clearly. So this point, that is ceruminous glands, are present in the cartilaginous part of the external auditory meatus, is important that it can be asked in your MCQ. It can be asked in your MCQ, or even it can be asked in the AAPGET examinations and all. Okay, so kind of give a bit of attention to that. Sebaceous glands are also present along with ceruminous glands. Ceruminous glands are nothing but modified sebaceous glands which produces cerumen or earwax. Okay, so that is regarding the your external acoustic meatus. So external ear consists of auricle or pinna, and external acoustic meatus or external auditory meatus. Pinna parts helix, antihelix, tragus, antitragus, scaphoid fossa, and concha. And then it is formed by elastic cartilage, and it is of what you will tell. It is covered by skin, while the external auditory meatus, it is sinusly curved, and upon coronal section, it is oval in shape, and it is 20 in length total, and it is divided into bony and cartilaginous part. Bony part is the inner part or the medial part. The cartilaginous part is the outer part or the lateral part. This consists of 8 This is 24 and the cartilaginous part. It is made up of C-shaped cartilage, and the gap is filled by fibrous tissue, while the bony part is made up of C-shaped tympanic plate of temporal bone, but the gap is filled by the squamous part of temporal bone. Less sebaceous glands, more sebaceous glands and ceruminous glands. Ceruminous glands are nothing but modified sebaceous glands which produces cerumen. Now, what is the function of this external ear up to the tympanic membrane? See, the pinna helps to kind of funnel in. We use the funnel to kind of what do you tell gather the fluids into a part through a narrow passage, right? So like that, this what do you tell auricular pinna helps to funnel in the sound waves from the source of sound. The sound waves comes from the outside, and they funnel in into the external acoustic meatus, and the external acoustic meatus carries the sound waves until the tympanic membrane. Okay, so that is the function of the external acoustic meatus and the auricular pinna. Now, regarding the blood supply of the horizontal external auditory meatus, you can write the deep auricular branch or deep auricular artery and superficial temporal artery and posterior auricular artery. All the three supplies to the external auditory meatus. And coming to the nerve supply, you can add up the point of auriculotemporal nerve and the what you will tell auricular branch of vagus nerve. Auricular branch of vagus nerve and the auriculotemporal nerve and a part of the greater auricular nerve also. Okay, so that is the nerve supply, and the what you will tell venous drainage is done by the branches of external jugular nerve, external jugular vein. Okay, so this is regarding the external ear, including auricle or pinna and the external auditory meatus. Okay, now we will move on to the partition that is in between the external ear and the middle ear. Okay, so this eardrum or tympanic membrane is located in between the external ear and middle ear, right? So that is why it is called as a partition. So it is nothing but a thin membrane, like translucent membrane. It is thin and it is translucent. What is translucent? Which allows the light to pass through. Okay, so it is thin, it is translucent membrane which act as a partition in between the external ear and middle ear. Okay, it is nothing but a thin uh, what is the translucent membrane that act as partition in between. You can see this is the middle ear cavity, this is the external ear, so it acts as a partition in between middle ear and external ear. Okay, and then it is oval in shape. It is oval in shape, and the size is 9 into 10 in size. Okay, the length and breadth, it is 9 into 10 and the direction of the tympanic membrane is important. It is directed downwards, forwards, and laterally. It is directed downwards, forwards, and laterally. And the location, it is located obliquely. Okay, it is located. You can see that this is not straight, right? It is located obliquely, so that it creates an angle. It creates an angle with the floor of the external auditory meatus. I'll repeat once more. Tympanic membrane is nothing but a thin translucent partition in between middle ear and external acoustic meatus, and then it is oval in shape. The size is 9 to 10 mm in size, and it is located obliquely so that it creates an angle here. It creates an angle of 55 degree. It creates an angle of 55 degree with the floor of the external acoustic meatus. That is important. This 55-degree angle may be asked for your MCQs. Okay, so note the point: ceruminous glands and the 55-degree angle. What is the angle made between the eardrum or the tympanic membrane with the floor of the ear external acoustic meatus? Okay, that is 55 degree. Okay, then we'll move on to the attachment. How it is attached? This membrane, as I have told, it is a membrane, right? So it should attach somewhere. So it is attached. We have told the bony part of the external acoustic meatus is C-shaped. It is formed with the C-shaped tympanic plate of temporal bone, right? Here also, the tympanic membrane is also attached to a tympanic sulcus. Tympanic membrane is attached to a tympanic sulcus. You can see this part is the tympanic sulcus. Okay, the what you will tell lower part or the major part of the tympanic membrane is attached to the tympanic sulcus of tympanic temporal bone, tympanic sulcus of temporal bone, and the parts which is attached to the tympanic sulcus, part which is attached to the tympanic sulcus, it is what you tell tightly stretched and attached, tightly attached to the tympanic sulcus. So just keep it on mind. We'll move on to the what you tell when we discussed furthermore. Okay, attachments. The lower part is attached to the tympanic sulcus, C-shaped tympanic sulcus. The upper part is attached to the tympanic notch. So this part here is tympanic notch. This part here is tympanic sulcus. Okay, so that is regarding the attachments. Now regarding the surface. Now regarding the surface, there is an outer surface. So this is the outer surface. This is the inner surface. There is an outer surface and an inner surface. Okay, the outer surface is lined by what we call thin skin and is concave. You can see it is concave, right? Outer surface is thin and it is lined by, oh, sorry, it is thin and lined by skin, and the inner surface it is convex. Outer surface is concave. I'll repeat once more. Tympanic membrane. It has two surfaces, outer surface and inner surface. Outer surface is concave and lined by thin skin, and the inner surface it is convex. Inner surface it is convex, and it has an maximum point of convexity. You can see this is the maximum point of convexity. You can see this part. This is the maximum point of convexity where the tip of the handle of malleolus is attached. Okay, I'll repeat once more. The tympanic membrane is having an outer surface and an inner surface. Outer surface it is lined by skin and it is concave. Inner surface it is convex. Inner surface it is convex, and it is attached by the handle of malleolus. You can see this is the malleolus. The handle of malleolus is attached to the inner surface. You can see this is the handle of malleolus, and there is a maximum point of convexity that is called as umbo, where the tip of the handle of malleolus is attached. Okay, tip of the handle of malleolus is attached. Okay, outer surface, inner surface, outer surface skin is attached, is formed by skin, and it is concave. Inner surface is convex, and handle of malleolus is attached, and there is a maximum point of convexity where the tip of the handle of malleolus is attached. This is called as umbo. This point is also important. This may also be asked in your MCQs. Umbo, the maximum point of convexity is called as umbo, UMBO. Now, moving back to the attachment of the your what you'll tell tympanic membrane, as I have told, two parts, tympanic sulcus and to the tympanic notch. Tympanic sulcus, major part is attached. Whatever the part of the tympanic membrane is attached to the tympanic sulcus, they are tightly stretched or they are tightly pulled and attached. So the parts that is attached to the what is the tympanic sulcus, it forms the part of pars tensor. This part is called as pars tensor. The other parts which is attached to the tympanic notch, uh, two folds, two malleolar folds. This is the posterior malleolar fold. This is the anterior malleolar fold. You can see that this is the anterior malleolar fold. This is the posterior malleolar fold. Right. So the tympanic membrane that is attached to the tympanic notch in between these two folds, these two malleolar fold, anterior malleolar fold, posterior malleolar fold. This is the tympanic notch, the what do you tell, tympanic membrane attached to the tympanic notch in between the anterior and posterior malleolar folds are loosely attached, and that part is called as pars flaccida. I'll repeat, you can see here, this is pars tensa. This part here in between the anterior and posterior malleolar folds are called as pars flaccida, pars tensa and pars flaccida. Okay, so that is regarding the structure of the your tympanic membrane. I'll repeat, tympanic membrane is nothing but thin translucent transition partition in between the, not transition, partition in between middle and external ear, and it is oval. It is shape is oval, size is 9 into 10 mm, and then location, it is located obliquely, and the direction is downwards, forwards, and laterally. And as it is located obliquely, it forms a 55-degree angle with the floor of the external auditory meatus. And then it has two surfaces, outer and inner surface. Outer surface, it is lined by skin and it is concave. Inner surface, it is convex and attached with the handle of malleus. And then there is a maximum point of convexity where the tip of the what do you tell, handle of malleus is attached. This is called as your umbo, and then the attachment, the tympanic membrane is attached. Lower part is attached to the your what do you tell, tympanic sulcus of temporal bone. The upper part is attached to the tympanic notch, and the part that is attached to the tympanic sulcus, they are tightly stretched and attached, and that part is called as pars tensa. And what do you tell, the part that is attached to the tympanic notch in between the anterior and posterior malleolar fold, they are loosely attached, they are called as pars flaccida. Okay, so that is regarding the tympanic membrane. And then coming to the blood supply of the tympanic membrane, you can write that majorly it is supplied by the deep auricular and anterior tympanic arteries. And regarding the what is the lymphatic drainage, you can write the preauricular and retropharyngeal lymph nodes, preauricular and retropharyngeal lymph nodes. Then the what do you tell, the nerve supply, it is by the internal surface is done by the glossopharyngeal nerve, and the external surface is done by the auriculotemporal nerve. Okay, so that is regarding the what do you tell, the tympanic membrane. So this completes the external ear along with the tympanic membrane. Now we'll move on to the applied anatomy of the external ear along with the tympanic membrane. Because whenever you are writing a 5 mark question also, you might be asked, or you should kind of add the point of applied anatomy. You can write in case of external, in case of the applied anatomy related to the external ear, you can see congenitally there may be what I'll tell, this deformities to the pinna, that is anotia, microtia, or macrotia, and the perichondritis is nothing but the inflammation of the what do you tell, pinna. And then the external acoustic meatus, you can write that there will be what do you tell, automycosis. Automycosis is nothing but the what do you tell, fungal infection of the external acoustic meatus, or the what do you tell, yeah, external acoustic meatus. Fungal infection in the external acoustic meatus is called as automycosis, and otitis externa, or the inflammation of the external acoustic meatus, is called as otitis externa. And then coming to the your what do you call, tympanic membrane, uh, you can add the point of acoustic trauma. Heavy or large decibel sounds, high intensity sounds can cause high intensity sounds of more than 110 or 120 decibels can cause the rupture of the tympanic membrane, that is called as acoustic trauma. And myringoplasty is nothing but the surgery that we will do to kind of what you will tell repair the tear that is occurred in the tympanic membrane. Myringotomy is kind of incision or the surgery where we will put incision in the what you will tell tympanic membrane to drain the pus that is collected in the middle ear. Or another one is cone of light, which is nothing but a kind of what do you tell examination that we'll be looking in the otoscopic examination. So that is regarding the clinical anatomy. You can write regarding the your pinna, it is anotia, microtia, macrotia, and perichondritis. In the external auditory meatus, it is the otitis, otomycosis, otitis externa. Yeah, such kind of what do you tell clinical anatomies. And when it comes to tympanic membrane, you can write the acoustic trauma, myringoplasty, myringotomy, and the cone of light. Okay, so that is regarding the external ear along with the tympanic membrane. Now we will move on to the next part, that is middle ear. This middle ear is one of the commonest question for 5 marks. Okay, yeah. Moving on to the middle ear. Middle ear is also called as tympanic cavity or tympanum. It is also called as tympanic cavity or tympanum, and it is located or it is formed within the petrous part of temporal bone. Okay, it is formed within the petrous part of temporal bone, and the middle ear cavity or middle ear locates in between the external and internal ear. And it is nothing but an air-filled space. It is an air-filled space that is located in between the external ear and the middle ear. And then the shape. See, the shape is important. It is cubical in shape. It has 6 sides. Okay, so see, it's better to kind of imagine yourself. Whenever you study the middle ear, imagine yourself as sitting inside a cubical room, okay, which is having 6 what do you tell surfaces or walls. There is an anterior wall, there is a posterior wall, there is a roof or superior wall, there is a inferior wall or the floor, and then there is a right side wall which can be considered as a lateral wall, and there is a what do you tell left side wall which can be considered as the medial wall. Okay, so if you kind of consider or imagine like this, as you are sitting inside a cubicle room, and then study regarding the what you will tell this middle ear, it will be pretty easy for you to even to recollect, because when you are writing the exam, whenever the question comes, you can imagine that, because whenever you are sitting in a examination hall also, it might be having 6 walls, right? There will be a roof, obviously there will be a floor, and there will be an anterior wall, there will be a posterior, and then the right and left wall, which can be considered as lateral and medial wall. Okay, so then it will be pretty easy for you to kind of reproduce. Clear? Keep that in mind, and then kind of hear the topic. Yeah. So middle ear, it is nothing but it is also called as tympanum or tympanic cavity. And then it is a narrow air-filled space that is present within the or in between the external and middle ear, and it is formed within the petrous part of temporal bone. Now the shape is cube in shape, and the anterior posterior, you can see here the anterior posterior diameter and the vertical diameter or superior inferior diameter. Anterior posterior and superior inferior diameter is the same, that is 15 mm in size. Anterior posterior diameter is 15 mm, vertical diameter is 15 mm. Okay. Then, what I will tell, the both the medial and lateral walls, both the medial and lateral walls, they are convex. Okay, they are convex, so that they are kind of what you will tell, they are kind of near to each other. Okay, so as they are convex, the kind of when you take a coronal section of the your middle ear, it will be in the shape of biconcave in shape. Generally, it is cubic in shape, and when you take a conical, when you take a coronal section, then it forms the biconcave shaped, because the medial and lateral walls are convex in shape, and they are kind of nearby to each other. Okay, I'll repeat once more. Middle ear, it is also called as tympanum or tympanic cavity. It is nothing but an air-filled space in between the external ear and middle ear. and then it is located within the petrous part of temporal bone. Then coming to the shape, it is cubical in shape, and the anterior posterior diameter is 15 mm. The vertical diameter is also 15 mm, and at the middle, the medial and lateral walls are more nearby, so that makes the biconcave shape whenever a coronal section is taken. Now we'll see regarding the parts. Majorly, the middle ear cavity or tympanic cavity is having two parts. That is tympanic cavity proper, and epitympanic recess. Tympanic cavity proper and epitympanic recess. In this diagram, you can easily make out that the tympanic cavity proper is nothing but the space of the space of the middle ear cavity that is opposite to the tympanic membrane. Whatever the space of the tympanic cavity extends from the upper part of the tympanic membrane until the lower part is called as tympanic membrane proper. The part that is above the tympanic membrane or the upper part of the tympanic membrane is called as epitympanic recess. You can see here, this is the upper part of the tympanic membrane, and this is inside, this is your tympanic cavity proper, and above this you can see this part here is your, what you will tell, epitympanic recess. And there is another part also a bit low, that is below the lower end of the tympanic membrane. There is another part that is hypotympanum. Just leave it, it is a negligible part. Okay, so above the upper part, or above the tympanic membrane, whatever the space present of the middle ear cavity is called as epitympanic recess. The part that is opposite to the tympanic membrane is called as tympanic cavity. That is regarding the part. Introduction is over. Tympanum or tympanic cavity, narrow air-filled space between the external and internal ear. It is present within the petrous part of temporal bone. Shape is cubic shaped, and the anterior posterior diameter and the vertical diameter is 15 mm. And whenever you take a coronal section, it is in biconcave shape. Why? Because the medial and lateral walls are closer each other at the center, and then parts, that is your tympanic cavity proper and the epitympanic recess. Okay, so that is regarding the parts. Now we'll move on to the communications. Communications anteriorly. Anteriorly, the, what you will tell, tympanic cavity communicates with the nasopharynx. Anteriorly, tympanic cavity communicates with the nasopharynx. You can see here this part here. Anteriorly, it communicates with the nasopharynx through a tube called as eustachian tube. Anteriorly, it communicates with the nasopharynx through the eustachian tube. Posteriorly, it communicates with the mastoid antrum. Posteriorly, it communicates with the mastoid antrum through the adductus. Okay, I'll repeat. Communications, anterior communication and posterior communication. Anteriorly, middle ear cavity communicates with the nasopharynx through a tube called as eustachian tube, or called as pharyngotympanic tube, or called as auditory tube, eustachian tube, or pharyngotympanic tube, or an auditory tube. So anteriorly, the middle ear cavity is communicating with nasopharynx through eustachian tube. Posteriorly, it is communicating to the mastoid antrum through the adductus. Okay, so that is regarding the communication. Now we'll move on to the major part, that is the wall. Okay, as I have told, it is having 6 walls. We'll start with the roof. Okay, you are sitting inside, you are sitting here, so this is the roof. Roof, or called as superior wall. Superior wall, it is also called as roof. It is called as tegmental wall. You can see here also, this part or this wall is called as tegmental wall. Why? Why? Because this part of the bone, or this part or the roof is made up of tegment tympani bone of temporal bone. Okay, I'll repeat. The roof is made up of tegment tympani. That is why this, what you'll tell, roof is also called as tegmental wall. Roof is called as tegmental wall. Why? It is formed by a bony plate of temporal bone called as tegment tympani. Okay, and this wall or the roof helps to kind of separate. Roof helps to kind of separate. You see here, this is the roof. The roof helps to separate the middle ear cavity from the middle cranial fossa. Roof helps to separate the middle cranial fossa from the middle ear cavity. But in young children's, here is the presence of petrotympanic fissure. In young children, this petrotympanic fissure or the petrotympanic suture, okay, that will not be joined, so that the middle ear cavity is in kind of communication with the middle cranial fossa. In the younger children, but in adults, this is fused and there is no communication between middle cranial fossa and the middle ear cavity. So this partition, roof of the what do you tell middle ear cavity, roof of the middle ear cavity is also called as tegmental wall. Why? Because it is formed by the bony plate called as tegment tympani. It separates the middle cranial fossa from the middle ear cavity, and in young children it was patent, but then in adults it will be fused. Okay, that is regarding the superior wall. Now coming to the inferior wall or floor. Cube, it has six parts. So the roof is over. Now we are dealing with the floor. Okay, you can see this wall, or this is the floor. The floor is related. You can see here. The floor is related to your what you will tell, or the floor is also called as jugular wall. Floor is also called as jugular wall. Roof is called as tegmental wall. Floor is called as jugular wall. Why? Why? Because it is related to the, or the bony plate that forms the floor is related to the what you will tell, the superior bulb of internal jugular vein. Okay, I'll repeat once more. This is the floor. The floor is formed by a bony plate, and the bony plate is related to superior bulb of the internal jugular vein. That is why the floor is also called as jugular wall. Okay, roof is called as tegmental wall, floor is called as jugular wall, and there is a canalicus or opening. There is an opening that is near to the medial wall. There is an opening in the floor which is near to the medial wall for the passage of tympanic branch of glossopharyngeal nerve. I'll repeat once more. Floor is also called as jugular wall. Why? Because the bony plate which forms the floor is in relation with the superior bulb of internal jugular vein, and in the floor there is an opening called as canalicus that is near to the, this is the medial wall, it is near to the medial wall for the passage of tympanic branch of glossopharyngeal. So that finishes the floor. Now we will see regarding the anterior wall. Okay, you can see what I will tell, this we are looking from the this is this part. You can see here there is no, we cannot kind of identify in this diagram. Just look at this diagram. Okay, this is the anterior wall. See this diagram, we are looking from the lateral wall. Okay, there is no lateral wall here. We are looking from the lateral wall. So this is the anterior wall. Anterior wall is also called as carotid wall. Superior or roof is called as tegmental wall. Floor is called as jugular wall. Anterior wall is called as carotid wall. Okay, so this is the carotid wall. Why? Why? Because the bony plate that forms the anterior wall is in relation with the internal carotid artery. You can see the artery here. So this wall is in relation with the internal carotid artery. That is why this anterior wall is called as carotid wall. Okay, so in the carotid wall, upper part upper part is having an opening for the passage of tensor tympani muscle. You can see here, this is the tensor tympani muscle. You can see here the opening. Okay, so this is the opening in the uppermost part. There is an opening for the passage of tensor tympani muscle. In the middle part, there is an opening for the passage of pharyngotympanic tube, or called as eustachian tube, or called as eustachian tube. Okay, uppermost part, tensor tympani muscle passage. Middle part, opening for pharyngotympanic or eustachian tube. Lower part, the what you will tell, bony plate is in relation with the your internal carotid artery. Okay, so that is regarding the anterior wall. Now we have discussed regarding roof, floor, and anterior wall. Now we will see regarding the posterior wall. You can see this wall here is the posterior wall. This is the posterior wall. Okay. Roof, floor, anterior wall, and posterior wall. Okay. So this posterior wall, it is also called as mastoid wall. Why? Why? Because we have told in the communications, right? Posteriorly, it is communicating with the mastoid antrum. So behind this wall, this wall helps to kind of separate the mastoid antrum. Here it will be mastoid antrum, or else you can see here. See here. This is the mastoid antrum, and this is the posterior wall. This is the posterior wall. Okay. So the posterior wall, it is also called as mastoid wall. Why? Because the bony plate is in relation with the mastoid antrum. So in the posterior wall, superiorly there is a large opening. You can see there is a large opening, right? So that opening in the posterior wall superior part is called as additus, which helps to kind of communication, or which is the communication in between the middle cavity and the mastoid antrum. You can see here, this is the additus. This is the additus. Okay, right. So then what else is there? There is a conical projection. There is another what do you tell, feature here. First feature is additus. Second feature is conical projection. This conical projection is called as pyramid. You can see a conical projection here, which is near to the medial wall. This is called as pyramid. And at the apex, you can see this is the pyramid. This is the apex. So at the apex, you can see a white line here. This is nothing but the stapedius muscle. Okay, at the apex, there is the passage of the tendon or stapedius muscle. I repeat, in the posterior wall, superior part, there is a large opening which is called as additus, which helps to communicate between the middle cavity and the mastoid antrum. And in the lower part, near to the medial wall, there is a conical projection which is called as pyramid. And at the apex of the pyramid, there is the passage of the tendon of your stapedius muscle. Okay, and then lateral to, you can see lateral to the your what you will tell pyramid. This is pyramid. Lateral to the pyramid, there is another opening, or there is another canalicus, which is the posterior canalicus of the passage of the cauda tympani branch of facial nerve. Cauda tympani is a nerve which is a branch of facial nerve. Okay, so that nerve has or passes into the your medullary cavity through the posterior canalicus that is present in the posterior wall. I'll repeat once more. Roof is your tegmental wall. Floor is your what you'll tell jugular wall. Anterior wall is carotid wall. Posterior wall is your mastoid wall. Why? Mastoid antrum is related. Superiorly there is an opening additus. Inferiorly and medially, near to the medial wall, there is a pyramidal eminence, which is called as conical conical eminence, which is called as pyramid. And at the apex, there is the attachment or the passage of the tendon of stapedius, and then a bit lateral to the pyramid, there is a presence of posterior canalicus for the cauda tympani nerve, which enters into the cavity, and the cauda tympani is nothing but a branch of the facial nerve. Okay, then comes the fifth wall, that is the lateral wall. You can see the lateral wall here. Here you can see here. This is the lateral wall. This is the lateral wall. Lateral wall is called as tympanic wall. Tympanic wall. You know why it is called as tympanic wall or membranous wall. It is also called as membranous or tympanic wall. Why? Because the tympanic membrane is present, right? So it is called as membranous or tympanic wall or lateral wall. Why? Because there is a presence of tympanic membrane. Okay. And in the lateral wall, there are one major canalicus. You can see one major canalicus is present, that is called as anterior canalicus of cauda tympani. Anterior canalicus of cauda tympani. So the what you tell cauda tympani nerve enters the middle cavity through the, you can see the posterior canalicus in the posterior wall, and it exits the middle cavity through the your what you tell anterior canalicus that is present in the lateral wall. Okay, lateral wall is also called as membranous wall or tympanic wall. Okay. Then the last wall, that is the medial wall. Medial wall, you can see this is the medial wall here, or this is the medial wall here. This is called as labyrinthine wall. This is called as labyrinthine wall. You know that the medial wall separates the middle ear from the internal ear, right? Another name for internal ear is labyrinth. Internal ear is also called as labyrinth. That is why the wall of the middle ear or the medial wall of the middle ear is called as labyrinthine wall. I'll repeat once more. Roof is called as tegmentine wall. Why? Because bony plate uh, that is named as tegment tympani. That is why the roof is called as tegmentine wall. Floor is called as jugular wall. Why? Because the bony plate is related to the superior bulb of internal jugular vein. Anterior wall is called as carotid wall because the lower part of the bony plate is related to the internal carotid artery. The posterior wall is related to the mastoid antrum, that is why it is called as mastoid wall. Lateral wall is related to the tympanic membrane, that is why it is called as tympanic wall or membranous wall. The medial wall is called as labyrinthine wall. Why? Because it is in relation with the, or it is separating the middle ear cavity from the internal ear, or called as labyrinthine wall. Now, what are the features of the labyrinthine wall? The first and foremost is large round prominence. You can see here. You can see here large round eminence, which is called as what you will tell promontory. Okay, there is a large round eminence in the medial wall called as promontory. This promontory is happening, or the bulging or the prominence is occurred due to the first turn of cochlea. The first turn of cochlea is present here. That is why that produces a bulge in the medial wall, which is found as a round large eminence, which is called as promontory. Nothing else. There is a round protrusion in the medial wall, which is called as promontory. Why? Because it is caused due to the cochlea. Okay. Then posterior superior to the promontory, there is a opening which is oval in shape, that is called as oval window. Posterior superior to the, you can see it is posterior and superior to the promontory, there is an opening which is oval, is called as oval window, or called as fenestra vestibuli, or called as fenestra vestibuli, which will be covered by the foot plate of stapes or stapes. Okay, I'll repeat. Posterior superiorly, there is an opening which is oval in shape, which is called as oval window or fenestra vestibuli, which is covered by the foot plate of stapes. Then posterior inferior to the promontory, there is another opening which is round in shape, which is called as round window or fenestra cochleae. Okay, fenestra vestibuli, oval in shape, fenestra cochleae, round in shape, fenestra vestibuli, posterior superior to promontory, fenestra cochleae, posterior inferior to the promontory, and this will be covered by secondary tympanic membrane. This will be covered by oval window will be covered by foot plate of stapes. Round window will be covered by secondary tympanic membrane. Okay. Then just above the oval window, just above the oval window, you can see it is easily, you can see here, just above the your oval window, you can see a what you will tell prominence of facial canal. Okay, above the oval window you can see prominence of facial canal. Okay, so this is the prominence of facial canal above the oval window. Then yeah, these are the main features that is present in the medial wall. I'll repeat once more. Large round eminence called as your what you'll tell a promontory, posterior superiorly oval window or fenestra vestibuli, posterior inferiorly round window or fenestra cochleae, and then it is the facial canal above the oval window. So that finishes the boundaries. Okay, that is roof, floor, anterior, posterior, lateral, and medial wall. Okay, now moving on to the contents of the tympanic cavity. Majorly, the contents are the what you tell bones. There are three bones. You can see this is the malleus, this is the incus, this is the stapes. Three major bones: malleus, incus, and stapes. So that is the contents of tympanic cavity. Three bones are present. They are malleus, incus, and stapes, and they are joined together. So this is the malleoincudial joint, and this is the incudo-stapedial joint. So two joints, malleoincudial joint and the incudo-stapedial joint. three bones and two joints. Then there is the presence of two muscles. You can see here, this is tensor tympani. This is tensor tympani and stapedius muscle. Three bones, malleus incustapis, two joints, malleoincudial and incudostapedial joint, and then two muscles, that is tensor tympani and what do you call tensor tympani and stapedius muscle. And then coming to the, as I have told, it is air filled, so air is a major content. And the last contents are your nerves and vessels. One of the major nerve you have to mention is cauda tympani nerve and other nerves, along with vessels, arteries. Okay, arteries that supply to the middle ear. I'll repeat once more. Contents are your three major bones, malleus incustapis, two joints, two muscles, that is tensor tympani and stapedius, and then nerves, that is cauda tympani nerve and other nerves, and then the arterial and venous drainages, and then the major content is air. Okay, so that kind of finishes the major part of your middle ear. Now regarding the uh, blood supply of the or arterial supply of the middle ear, and the anterior tympanic branch of maxillary artery and posterior tympanic branch of stylomastoid artery that supplies to the middle ear. Venous drainage is into the superior petrosal sinus and the pterygoid plexus of vein. Arterial supply, anterior tympanic branch of maxillary artery and posterior tympanic branch of stylomastoid artery. Venous drainage is over. Lymphatic drainage is into the preauricular and retropharyngeal lymph nodes, and the nerve supply. Nerve supply is important. The tympanic branch of glossopharyngeal nerve. We have told that it enters into the middle ear cavity through the through the canaliculus that is present in the which wall that is in the floor, right? Okay, so the tympanic branch of glossopharyngeal nerve and the superior and inferior cortical tympanic nerves. Okay. So that finishes the points of your middle ear. Okay, then the middle ear applied anatomy. Applied anatomy, you can tell us otitis media, or a bit of furthermore detail is acute suppurative otitis media, ASOM, acute suppurative otitis media, and chronic suppurative otitis media. Then mastoiditis, that is inflammation of the mastoid antrum, acute suppurative otitis media or ASOM, and CSOM, which is chronic suppurative otitis media, and then mastoiditis. Then, yeah, that is regarding the applied anatomy of your middle ear. Okay, I'll repeat once more. It is also called as tympanum and tympanic cavity. It is an air-filled, narrow air-filled space in between the middle and internal ear, petrous part of temporal bone, and then cube in shape, biconcave in shape. The diameters, the parts, that is tympanic cavity proper and epitympanic recess, communications, anterior and posterior communication, eustachian tube anteriorly, the mastoid antrum posteriorly, and then regarding the what you will tell the walls, that is the six walls, roof, floor, anterior, posterior, lateral and medial walls, and the features or the perforations or the canaliculus that is present within the walls, and then the blood supply, nerve supply, and lymphatic drainage along with the clinical anatomy is over. Now we will move on to the uh, next part, that is the inner ear. Inner ear or internal ear. It is also called as labyrinth. It is also called as labyrinth. Okay, this is a bit what you tell complex. Okay, we'll go by stepwise so that you can understand what you tell the points which I am trying to tell. So internal ear is also called as your labyrinth, and this is also present within the petrous part of temporal bone. This is also present within the petrous part of temporal bone. The labyrinth or internal ear is divided into two major parts. There are two major parts for the internal ear. They are bony labyrinth and membranous labyrinth. Okay, I repeat. Inner ear is also called as labyrinth. It is located within the petrous part of temporal bone. There are major two parts of labyrinth. your what you tell bony labyrinth and membranous labyrinth. Okay, there are three major parts for bony labyrinth and three major parts for membranous labyrinth. Three parts for bony labyrinth, three parts for membranous labyrinth. So, what are the three parts of bony labyrinth? They are cochlea, vestibule, and semicircular canals. Mhm. You can see here. This is the cochlea. This is the cochlea. This is the vestibule, cochlea, vestibule, and semicircular canals. And here you can see cochlea, vestibule, and then semicircular canals. Cochlea is the most anterior one, vestibule is the middle part, and the semicircular canals is the posterior. Okay, internal ear, petrous part of temporal bone, it is located. Two major parts, bony labyrinth and membranous labyrinth. Bony labyrinth is further divided into three parts. The most anterior part is cochlea, the middle part is vestibule, the posterior part is semicircular canals. Okay, now the membranous labyrinth is also having three parts. Okay, is also having three major parts. They are nothing but the semicircular or the spiral duct of cochlea or organ of corti. You can see here the color change. This blue here is your what do you call spiral duct of cochlea or organ of corti. Then utricle and saccule, and then semi circular ducts with cristae. Here now there are two major parts of internal ear, bony labyrinth and membranous labyrinth. Bony labyrinth is divided into three parts, cochlea, vestibule, and semicircular canals, while the membranous labyrinth is divided into spiral duct of cochlea or organ of corti, then utricle and saccule, and then the third one is your semicircular ducts. It is not canal, it is ducts, semicircular ducts with cristae. Okay, so now the another point. Now you know the parts of the what do you tell bony and membranous labyrinth. Now how it is located? The bony labyrinth is the outermost part. You can see here. This is the bony labyrinth, and within that you will find out the membranous labyrinth. Okay, outer part is bony labyrinth. Inner part is membranous labyrinth. Okay, so the membranous labyrinth is located within the bony labyrinth. I hope that is clear. Okay. Now, one more point. In between the bony and the membranous labyrinth, you can see this is the bony labyrinth, this is the membranous labyrinth. So, in between the bony and membranous labyrinth, there is a presence of a liquid called as perilymph. Perilymph is nothing but the fluid of the bony labyrinth. Then within the membranous labyrinth, there is another liquid or fluid, specialized fluid that is called as endolymph. This is called as perilymph. This is called as endolymph. Okay. Now, the points or the introductory points are over. I'll repeat. The internal ear is also called as labyrinth, and it is present within the petrous part of temporal bone. There are majorly two parts for the internal ear, that is bony labyrinth and membranous labyrinth. Labyrinth is having three parts. Anteriormost is cochlea, vestibule, and semicircular canals. Membranous labyrinth is having three parts. That is your spiral duct of cochlea, which is present within the cochlea, and then the utricle and saccule, which is present within the your vestibule, and then semicircular canals or semicircular ducts or canals, sorry, semicircular ducts with cristae that is present within the your semicircular canals. Okay, and then the bony labyrinth is the outer part, membranous labyrinth is inner part, and the liquid of the bony labyrinth is perilymph. The fluid of the your membranous labyrinth is endolymph. Perilymph, endolymph. Okay. Now we will start with the in detail of the bony labyrinth. Bony labyrinth, the first one or the anteriormost one is called as cochlea, right? Cochlea, why it is called as cochlea? Because it is like the shell of a snake. That is why it is called as cochlea, and it is the anteriormost part of the bony labyrinth. And as I have told, it is like the shell of a snake, right? So obviously, it should take spiral. It should be spiral, right? So the cochlea is also spiral in shape. You can see in this here. You can see the cochlea is also spiral in shape, and To be spiral in shape, there should be a central axis, right? Around the central axis, you will be taking turns, right? So the central axis around which the cochlea is making turns is called as modulus. You can see, you can appreciate here, this part of the bone, this part of the bony labyrinth around which you can see this, these are the turns, or this is the coronal section. You can see this is the modulus. So around the modulus, the what you tell cochlea is taking turns. Now, how many turns? How many turns? 2 and 3 by 4, 2 and quarter turns. You can see here, this is one full turn, this is second full turn, and you can see here a quarter turn. Okay, so 2, 3 by 4 turns, 2 and 3 quarter turns of what you tell cochlea are present. I'll repeat once more. Cochlea is the anteriormost part of bony labyrinth. It is called as cochlea. Why? Because it resembles the shape of a shell of a snail. And then the cochlea takes turns around a central axis that is called as modulus. And it takes 2 and 3 by 4 turns. And then now, from the bony labyrinth, there are certain what you tell bony parts. There are certain bony extensions into the your what you tell cochlear canal. Okay, see, you can see here this outer part. This is the outer part of your cochlea, and the cavity inside is called as cochlear canal. You can see the cochlear canal, right? And this is the modulus, and you can see small bony extensions here, small bony extensions into the canal. You can see here this small bony extensions here. This one, this one. These are called as spiral lamina. Okay, uh, some names I have told now. Modulus, small extensions into the cochlear canal is called as your what you'll tell spiral lamina. And this spiral lamina helps to divide. The spiral lamina helps to divide the cochlear canal into an upper part called as you can see, you can make out here. This is the spinal lamina. The spiral lamina divides the cochlear canal into scala vestibuli and scala tympani. I'll repeat once more. The cochlear canal is divided into two major parts. Upper part is called as scala vestibuli, lower part is called as scala tympani. You can see here also scala vestibuli and scala tympani. But there is another part called as scala media, right? In between the scala vestibuli and scala tympani. That part forms the cochlear duct. That part forms the cochlear duct, which is a part of the membranous labyrinth. So we will deal afterwards. Okay. So this much you have to understand. Cochlea. It is resembles the shape of a shell of a snail. It is the anteriormost part of bony labyrinth, and it takes turns around a central axis of bone, central bony axis called as. Don't confuse this yellow part. No, that is not the central axis. This part you can see here. No, this bony part is the modulus, and there are small extensions from the modulus which are called as spiral lamina into the cochlear canal, which divides the cochlear canal into an upper part called as scala vestibuli and lower part called as scala tympani, which will be filled with the perilymph. The perilymph is filled within the scala vestibuli and scala tympani. Okay, and another region is there, scala media, which is called as cochlear duct, which comes under the membranous labyrinth. Okay, now as I have told, the cochlear canal and regarding the scala vestibuli and scala tympani, right? The scala vestibuli and scala tympani, they won't communicate each other except at the end. Except at the end, you can see a small opening here. This small opening is called as helicotrema, through which the scala vestibuli, that is scala vestibuli and scala tympani communicates. Other parts, there is no communication of scala vestibuli and scala tympani. I'll repeat once more. Cochlea, anteriormost part, what you'll tell of bony labyrinth, shell of a common snail, a central bony axis around which it takes turn, that is called as modulus, and small parts of bones enters into the cochlear canal, divides it into upper part scala vestibuli, lower part scala tympani, and then Scala vestibulae and tympani is containing a fluid called as perilymph, and they doesn't communicate until the and small opening at the end of the last turn that is called as helicoderma. So that finishes cochlea. Now we will see regarding the membranous labyrinth or the bony labyrinth, sorry, bony labyrinth of vestibule. Cochlea is over. Now middle part is vestibule. Okay. Vestibule, it is the central part of the bony labyrinth, and see, this vestibule is having walls. The lateral wall contains oval window. The lateral wall contains, you can see, this is the oval window and round window which communicates with the your medullary cavity. Vestibule, it is the middle part of bony labyrinth and it has walls. Lateral wall, it communicates with the medullary cavity through oval window and round window. Anteriorly, you can see the cochlea is present. Medially, there is a presence of the internal acoustic meatus. Okay, medially, in the medial wall, it continues as the internal acoustic meatus, and then there are certain recesses. You can see here, this is the ellipsoid recess, this is the spherical recess, this is the cochlear recess. The ellipsoid and or the elliptical and the spherical recess is divided by a vestibular crust. Okay, these are the features that is present in the medial wall. I'll repeat, anteriorly it is the cochlear duct. Uh, the what is the laterally it communicates with the medullary cavity through oval window and round window, and then medial wall it has the extension of the internal acoustic meatus, elliptical recess, spherical recess, and cochlear recess along with the vestibular crest. And then posteriorly, this is the posterior wall. Posteriorly, it is in what you tell in relation with the semicircular canals. Anteriorly cochlea, posteriorly semicircular canals, medially internal acoustic meatus, elliptical recess, spherical recess, cochlear recess, and vestibular crest. Laterally, there is a presence of oval window and round window. Okay. Right. So that is regarding the vestibule. Now we will see regarding the semicircular canals. Semicircular canals, there are majorly three semicircular canals. One is anterior or superior semicircular canals, one is posterior semicircular canal, one is lateral semicircular. Anterior, posterior, and lateral. So these three semicircular canals are present at 90 degree to each other. Okay, they are present at 90 degree to each other, and then they open. They kind of open the posterior wall of vestibule into in five openings. You can see here. Yeah, in this it is a bit more clear. You can see here. These are the semicircular canals. These are semicircular canals. They open into the posterior part of the vestibule. Clear? There are three semicircular canals: anterior, posterior, and lateral, and they open into the posterior part of the vestibule. And each canal has two openings. You can see if you consider this anterior semicircular canal, there is one opening, and here it is second opening, right? So semicircular canal, three semicircular canals, anterior, posterior, lateral, two openings. They open into the posterior part of your what you will tell. Okay, so that is regarding the semicircular canals. So this finishes the bony labyrinth, cochlea, vestibule, and semicircular canals. Cochlea, vestibule, and semicircular canals. Now we will move on to the next part, that is membranous labyrinth. Okay, a bony labyrinth is over. Membranous labyrinth. Okay, membranous labyrinth. It is nothing but a closed cavity. It is nothing but a closed cavity with a specialized fluid called as endolymph. Closed cavity which is filled with a fluid called as endolymph. Okay, right. So the first what you will tell uh, membranous labyrinth is called as cochlear duct. I have shown you right in the bony labyrinth. You can see here this scala media, this middle part, scala media, or you can see here in this, it is clearly viewed. This is scala vestibulae, scala tympani, and this part is called as cochlear duct, right? Cochlear duct, which contains the organ of cortex. What is organ of corti? Organ of corti is the organ of chief organ of hearing. Okay. The first what is the membranous labyrinth we are going to discuss is cochlear duct, which contains the organ of corti. Right. Now, the cochlear duct, it occupies the middle part of the cochlear canal. You can see here, it is easily understandable here, scala vestibuli, scala tympani, and this is the cochlear duct. This part or the scala media part is called as cochlear duct. Okay, this whole part is called as cochlear canal, which is divided into three parts: scala vestibuli, scala tympani, and scala media. The scala media part is called as your cochlear duct or spiral duct of cochlea, or the place where the organ of corti is present. Okay, so the cochlear duct is separated from the scala vestibuli by a vestibular membrane. You can see this extension here. This is the vestibular membrane, or called as Reisner's membrane, which separates the scala media or cochlear duct from the scala vestibuli. Now, the cochlear duct is separated from the scala tympani by the presence of this membrane. This membrane is called as basilar membrane. Vestibular membrane separates scala vestibuli and the cochlear duct. This vestibular membrane is also called as Reisner's membrane, Reissners, Reisner's membrane. The basilar membrane separates the cochlear duct from the scala tympani. Okay. Then now we will discuss regarding the organ of corti. Organ of corti consists of outer hair cells. You can see here, these are the outer hair cells, these are the inner hair cells. This is the tectorial membrane, this is the tectorial membrane, this is the striae vascularis. Okay, I'll repeat, these many structures together is called as organ of cortex. I'll repeat once more. This whole part is called as cochlear duct. Cochlear duct is separated from scala vestibuli by a membrane called as vestibular membrane or Reisner's membrane. Cochlear duct is separated from the scala tympanal by a membrane called as basilar membrane. And within the cochlear duct, the organ of corti is present. Organ of corti consists of outer hair cells, inner hair cells, tectorial membrane, and the stria vascularis. Okay, and within the cochlear duct, what will be present? Endolymph will be present. See, just for your information, what happens is that whenever the sound waves is beating upon the oval window, that creates a kind of waves in the perilymph. That in turn kind of create waves in the endolymph. I'll repeat, sound waves create or beats the oval window, which in turn creates waves in the perilymph, which in turn create waves in the endolymph. So when the endolymph moves with in between these hair cells, they in turn kind of rub against the tectorial membrane. I'll repeat, waves in the endolymph, they comes in between the hair cells, they rub against the tectorial membrane. This rubbing creates an action potential. This rubbing creates an action potential, which in turn, hair cells are connected to the these hair cells are connected to the cochlear nerve, vestibulocochlear nerve. You might have learned, right? Which is nothing but the eighth cranial nerve. So vestibulocochlear nerve has two parts. One is cochlear part, one is vestibular part. Vestibular part uh, takes away the stimulates of the vestibular apparatus, while the cochlear part is connected to these hair cells. Okay, these hair cells, they rub against the tectorial membrane, which in turn creates a action potential, which will be sensed by the cochlear nerve, and then it will be taken to the brain. That is how the hearing is occurring. Sound waves, waves in perilymph, waves in endolymph, they moves the hair cells, they rub against the tectorial membrane, action potential grasped by the cochlear nerve, it will be taken. Okay, so this is regarding the what you'll tell spiral duct of cochlea or cochlear duct, and the what you will tell, organ of cortex. I'll repeat once more. Cochlear, whole cochlear canal. This is cochlear duct separated from the scala vestibuli, vestibular membrane or Reisner's membrane. Basilar membrane separates cochlear duct from the scala tympani, and then the cochlear duct contains the what you will tell, endolymph, and the major organ, that is organ of Corti. Organ of Corti includes outer hair cells, inner hair cell, tectorial membrane, striae vascularis. Okay, then you can write regarding the what you will tell, how it is the sound is being perceived. Now we will move on to the next part, that is the what you will tell, vestibular or the saccule and uterus. Okay, I'll repeat once more. Cochlea or the cochlear duct is over. Now the next part is saccule and utricle. Saccule and utricle is the membranous labyrinth that is present within the vestibule. Okay, within the vestibule is the bony labyrinth. Within the bony labyrinth, the saccule and utricle are present. Okay, and the saccule lies in the anterior-inferior part. This is the saccule. This is the saccule. It lies in the anterior-inferior part, and it kind of what you will tell, anteriorly it communicates with the cochlear duct. This is the cochlear duct. This is saccule. You can see it is communicating with the what you will tell, cochlear duct anteriorly, and then the posterior superior part. Okay, posterior superior part is called as utricle. Posterior superior part is called as utricle. This is saccule, this is utricle. Anteriorly saccule communicates with the cochlear duct. Posteriorly utricle communicates with the semicircular ducts. Okay, saccule communicates with cochlear duct. Utricle communicates with semicircular ducts. And then the what you will tell, the sensory organ in the cochlear duct, the sensory organ was organ of cortex. In the saccule and utricle, the sensory organ or the sensory receptor is maculae. Okay, the maculae is present in the medial wall of saccule and utricle, and this maculae helps for the perception of static balance. Okay, this macula is present, which is present in the medial wall of saccule and utricle. So the saccule and utricle is also filled with the your endolymph. Okay, all the complete membranous labyrinth is filled with endolymph. Okay, cochlear duct, yes. Now the next part is saccule and utricle. Saccule and utricle is also filled with the endolymph. So whenever this saccule and utricle consist of the sensory organ called as maculae. Maculae or macula is nothing but the sensory organ of static balance. So whenever you are moving in a lift, uh, so that movement or the linear motion is kind of what you will perceived or causes movements in the endolymph present in the utricle and saccule. That in turn will be perceived by the maculae, and actions will be done. Okay, I'll repeat once more. Utricle and saccule are the membranous labyrinth, and the sensory receptor that is present within the utricle and saccule is maculae. This maculae helps for the static balance whenever there is any motion in the linear motion in your body, then that will be perceived by the maculae, and this maculae is connected with the vestibular part of the vestibulocochlear nerve. Okay, cochlear duct, hair cells is connected to cochlear part of your what do you tell, vestibulocochlear nerve, while the macula is connected with the your vestibular part. Vestibular nerve. Okay. That is regarding the saccule and utricle. Now we will move on to the semicircular ducts. You can see the dark green parts here. These are semicircular ducts, and they open into the saccule, and at the opening you can see these are the openings. The openings are a bit broadened, so they are called as ampulla. Okay, these are semicircular ducts, and these are the openings. The openings are a bit broadened, that is why it is called as ampulla. And at the ampulla you can see this colors. There is a skin colored what you tell part right here. This part is called as cristae. Okay, I'll repeat once more. Cochlear duct, sensory part is organ of cortex. Utricle and saccule, sensory part is macula. Semicircular ducts, sensory part is cristae. Okay, This crispy can kind of respond to pressure changes in the endolymph caused by movements of the head. Whenever you are moving your head, the balance is kind of perceived by the help of the cristae that is present uh, in the ampulla of the semicircular duct. Okay, so that finishes the membranous labyrinth and the semicircular ducts. So all the three membranous labyrinth is also finished. Now we will move on to the blood supply of the labyrinth or the internal ear. Okay. The blood supply is done by the labyrinthine branch of basilar artery and the stylomastoid branch of posterior auricular artery. Okay, so that finishes your internal ear. Okay, internal ear, it is also called as labyrinth, and then bony labyrinth, membranous labyrinth, bony labyrinth, three parts, membranous labyrinth, three parts, cochlea, vestibule, and your what do you tell, semicircular canals, and then cochlea. You have to remember it takes turns, central axis modulus, and then the cochlear canal is divided into scala vestibula, scala tympani by the presence of spiral lamina, which is nothing but the extension from the modulus. And then the scala vestibulae contains perilymph. They won't communicate each other. At the end, they kind of what you'll tell communicate through helicotrema, then vestibule, then your semicircular canals, three semicircular canals, anterior, posterior, and lateral. Then membranous labyrinth, that is cochlear duct. Uh, Cochlear duct, it contains organ of Corti, outer hair cells, inner hair cells, what will tell membrane of tinctoria, uh, tectorial membrane, and then striae vascularis, and then your utricle and saccule containing maculae, and then semicircular canals, which contains cristae. Then the blood supply is from the labyrinthine branch of visceral artery and stylomastoid branch of posterior auricular artery. Then coming to the applied anatomy, any kind of what do you tell problem that is related to the internal ear will lead to sensory neural deafness. Okay, any kind of problems that is related to your middle and external ear will cause conductive deafness or conducting hearing loss, because the sound waves are conducted in the external and middle ear, but in case of internal ear they are being perceived, right? So any problems of the internal ear leading to deafness is sensory neural deafness, while any problems that is leading to uh, any problems in the middle and external ear, that can lead to conductive deafness. And another what you will tell clinical anatomy related to the internal ear is acoustic neuroma. It is nothing but a tumor of the Schwann cells of vestibulocochlear nerve. I'll repeat: internal ear. You can write the otitis interna or sensory neural deafness and acoustic neuroma. Okay, so that is the applied anatomy related to your internal ear. Okay. That is regarding the anatomy of ear. It is divided to three parts: external, middle, and internal. The parts: external ear, two parts: auricle and pinna and external auditory meatus. Middle ear, the what do you tell walls and the contents, the parts, the communications, and then the internal ear, bony and membranous labyrinth, and their features. And especially you have to add applied anatomy on each parts of the ear, so that kind of finishes the topic. I hope it was useful, and if you have any doubt, you can please ask.
Thank you, sir. Thank you so much for the session. On behalf of our Panchajanya organization, we are very thankful to you for accepting our invitation to conduct the session today. This session will be definitely useful for the students who are preparing for the exam, sir. We are very glad to have you in this session today. And once again, thank you so much, sir. Such a complex lecture you have explained in very easy way with so much of patience. Thank you so much, sir. And we'll wind up
Thank you.
the session now.
Yes, yes. Thank you.
Yes.